to Goshen TV's Pandora Box. Today, we'll be having health talk, and our guest is no other than Dr. Oluwadare Adepetu. Welcome to Goshen TV. Sir.
Thank you so much.
Dr. Adepetu is the Chief Medical Director, Novel Hope Medical and Fertility Center. Please, sir, let's know what attracted you to the field of medicine.
Thank you so much. My name is pronounced. I'm Dr. Adepetu. I'm a consultant obstetrician and gynecologist. I have a National Postgraduate Medical College Fellowship. I'm also a fellow of the West Africa College of Surgeons. What attracted me to the field of O&G? Well, let's say is the love for babies, because I like babies and I don't like seeing them sick. So that's why I'm in the field of O&G.
Thank you. Shortly, we'll be talking about fibroid, the monster called fibroid. Well, I'd like to ask, how long have you been in practice?
Well, I've been practicing for over 12 years now.
Are you thinking what I'm thinking? This young person? Okay, let's go ahead. What exactly is fibroid?
Fibroid, simply put, is a monoclonal disorder of the womb. The meaning of that is it simply grows from a cell. There is abnormal proliferation of one cell in the womb, and it grows fast to become fibroid. Fibroid is just a benign mass, a benign tumor of the womb. When we say benign, it means it's not going to kill, in quotes. So it's a benign tumor of the womb.
Okay, so over time we've heard, especially in this part of the world, that fibroid is caused by abortions, is caused by issues around pregnancy and miscarriages, is caused by spiritual issues. Now tell us, are these things myths or truths? If not, what causes fibroids?
Well, all that you have listed are actually not responsible for fibroid. The cause of fibroid, apart from genetic predisposition to fibroid, the other things that can cause fibroid will include women with low parity. Those are the people with fewer number of children. Women who delay childbearing, maybe for reasons of academics or career. Then those who smoke are at increased risk of fibroid. Women who don't practice exclusive breastfeeding, they are at increased risk. Then women of black race generally, they are at increased risk because fibroid is commoner among women of black race origin compared with the Caucasians.
Well, that's a very serious one, that black women are more likely to have fibroids?
Yes.
That's a very big matter. Sir, what has fibroid got to do with pregnancy? Does it stop pregnancy? How does it affect the child? Because we see that's why many women are afraid of having fibroids, because they fear they can't have babies.
When the word fibroid is mentioned on the street, many women take it as if it's like death sentence. No. When it comes to infertility and fibroid, we don't know which one comes first. It's like the proverbial chicken and egg, which one comes first. Is it because the woman is having fibroid, that's why she's not getting pregnant? Or because this woman has not been getting pregnant, that's why she has fibroid? We don't know which one leads to the other. But what we know is that when the womb is not occupied by the baby, then the tendency of the womb being occupied by fibroid is high. So that's why women of low parity, people who delay childbearing, people who smoke, women who indulge in red meat, these are people that are predisposed to developing fibroid.
So you're saying that nutrition also has a role to play?
Yes. Nutrition has a role to play. That was why I said initially that the cause of fibroid is multifactorial. Now, nutrition in the sense that if somebody is genetically predisposed to, the meaning of that is probably the mother has fibroid, so that means there's tendency for her to have. If that person does not engage in things that will make her have fibroid, if she has her children on time, she has many of them, breastfeed, she does not indulge in smoking, she does not indulge in consumption of too much of red meat, she may not develop fibroid, and she may not develop at all, or develop it late towards the end of her reproductive career.
This is Goshen TV, broadcasting independently from Port Harcourt, South Nigeria. We've come into the global media space to take a prime place to do the business of journalism and broadcasting in different and exciting ways.
On our platform, you will watch breaking news, special interview programs, for example, the Pandora Box, Stars, News Digest. There will also be Gist Hour and many more.
Goshen TV will offer you a platform to advertise your goods and services, as well as provide the opportunity for the coverage of your special events. To enjoy our various programs, follow us on YouTube, Instagram, Facebook, and Twitter. Goshen TV. This is The Tonic.
You heard that, viewers. You're listening to Dr. Oluwadare Adepetu, the Chief Medical Director, Novel Hope Medical and Fertility Center. Would like to ask, sir, what's the way forward? Every day people come up with ads on natural supplements that take off fibroid. You can take off your fibroids without surgery. Come to the local woman out there. People offer different things to clear fibroids. Do these things work?
I laugh because this question we get all the time, and it's unfortunate that out there are a lot of misinformation there. When a woman has fibroid, like I said, fibroid is not death sentence. Fibroid does not mean a woman cannot get pregnant. No, I have seen women with big fibroid and they carry pregnancy with it. That's what we call pregnancy coexisting with fibroid, and they carry the pregnancy to term. We have seen this happen many times. Now, when people tell them, come, we'll give you drugs that will make fibroid disappear without surgery, the management of fibroid is such that if fibroid does not disturb you, leave the fibroid, the two of you can coexist peacefully. The prevalence rate of fibroid is about 50 to 60%. The meaning of that is in women that are alive, the rate at which fibroid occur in them is, if you have like 10 here, 5 or 6 will have fibroid among black women. Now at postmortem, it's about 70 to 80%. The meaning of that is, if you have 10 bodies now that you need to carry out postmortem examination, that's the examination after death, 7 to 8 out of every 10 women you see fibroid. That means some people live their life normally without knowing that they have fibroid. That means they coexisted with the fibroid. So if fibroid does not disturb you, leave the fibroid. If fibroid disturbs you, when it becomes symptomatic, that's when we treat. And the treatment for fibroid is surgery, is removal. Remove the fibroid. And when a woman comes forward asking for removal of fibroid, the definitive treatment for fibroid is to remove the womb, because if there is no womb, there will be no fibroid. But when a woman comes forward and remove the fibroid, leave the womb, that's a conservative approach to management of fibroid. This woman is saying, I still want to use this womb. Now, when they now go for all this alternative treatment, I'll give you this, I'll give you that, what they give them are medications that will make the cleavage plane of the fibroid to be damaged. The cleavage plane is just like when you boil your raw egg. When you boil the egg, you bring it out of hot water, you don't leave it on the table, you put it in cold water. And the reason why you do that is so that peeling of the shell will be easy. See, there is a nylon, a thin membrane between the egg and the shell. Now, you need to put the hot egg in cold water so that the shell will not damage that nylon, to make your peeling easy. The same thing applies to fibroid. We have it like that during surgery. There is a pseudo membrane that surrounds the fibroid nodule, such that at surgery, you just shell it out easily, But when they take all these drugs, it blunts the cleavage plane, such it now looks like you boil your egg, you just put it on the table. Have you tried peeling such egg before? It looks very rough. That's what the womb will look like at surgery. So these are the problems that come with all this. We treat your fibroid, we give you herbs, we give you this. It's not true. Almost all all these women that have gone through this part of this natural treatment will eventually present in hospital for operation, and that surgery will now become more difficult. So women who have fibroids can live with their fibroid if the fibroid is not disturbing them.
Okay.
But when fibroid becomes symptomatic, that's when it starts to disturb them. Then they need to come to the hospital for evaluation and proper treatment.
So apart from where there's no presentation, where there's no stress, there's no other sign that a woman has fibroid, she can just live her
She can live her
and it
life.
doesn't stop her from having.
She can live. What are the symptoms that a woman will have to know that she has fibroid? Take for instance, if the menstruation becomes painful, if there is prolonged bleeding or heavy bleeding, then if there is intermenstrual bleeding, she has finished a menstruation before commencing another one, she's bleeding in between. Then if there is pain with the menstruation, these are things that a woman can see that can make her know that, okay, fibroid is there. Or if the tummy starts to protrude without being pregnant, then you can say, okay, it's fibroid. These are the reasons for a woman to seek treatment for fibroid. Otherwise, incidental findings of fibroid, maybe a woman has just gone for ultrasound and they saw a small fibroid nodule. It's nothing, just live your life.
Dear viewers, you've been listening to Dr. Oluwadare Adepetu of Novel Hope Medical and Fertility Center. Where, please, is Novel Hope Center, sir?
Thank you. Our facility is located at number 12B, Makele Estate, off Akpara East-West NTA Link Road in New Rumigbo Layout, Port Harcourt.
Thanks for coming on Goshen TV.
Thank you.
You heard so much today. This is Ella William West signing off. Thanks for staying with Goshen TV. Remember to subscribe to our YouTube channel and like all our social media handles as shown on your screen. See you.